Hello, I'm Dr. Elliot Hirschhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic health conditions like thyroid disease. In this video, I'm going to discuss how blood sugar is impacting your thyroid health. All too often in my office, I see patients with thyroid disease that also have several other chronic health conditions. One of the most common things I see in thyroid patients is blood sugar dysregulation. What that means is that your blood sugar is too high, too low, or a combination back and forth. Sometimes it's high, sometimes it's low. Dysglycemia, as it's called, can wreak havoc on your entire body, but specifically on your thyroid metabolism. There are 4 main ways that blood sugar can impact thyroid metabolism, and also 4 ways that thyroid metabolism can reversely impact blood sugar regulation. By the time we're done, you'll realize that these are very complex, interwoven physiological processes that must be addressed in all patients with thyroid symptoms. First, let's talk about how blood sugar affects thyroid. Increased blood sugar is responsible for many chronic conditions. Diabetes is number 1. It can also lead to heart disease and even dementia. The problem is that increased blood sugar from eating too many carbohydrates causes increased levels of systemic inflammation. Inflammation is like having a constant blowtorch destroying all of your blood vessels and nerves. Inflammation in the brain can decrease the production of thyroid-stimulating hormone, the message from the pituitary gland that tells the thyroid when it needs to make more hormone. So if there's less TSH, there will be less thyroid hormone produced, and then you will end up with hypothyroid-like symptoms. Increased blood sugar will also cause an increase in the insulin production by your pancreas. Chronically high levels of insulin can lead to an increased Th1 response by your immune system, which can trigger autoimmune Hashimoto's hypothyroidism, the #1 cause of low thyroid. Low blood sugar can also impact thyroid metabolism. When your blood sugar drops too low, a hormone called cortisol is released from your adrenal glands to help mobilize the production and release of blood sugar. This causes a burst or a surge of blood sugar, which can lead to the mechanisms of low thyroid we just discussed in regard to increased blood sugar. Additionally, increased cortisol can lower the conversion of one type of thyroid hormone, T4, to the usable form of thyroid hormone, T3. When this happens, hypothyroid symptoms can also result. Finally, increased cortisol can also impact the function of the hypothalamic pituitary axis in your brain, decreasing its production of thyroid hormone, again leading to low thyroid symptoms. These mechanisms result from low blood sugar causing spikes in cortisol, but there's another very common reason why cortisol can spike. It's something we all deal with on a daily basis. It's stress. Chronically high levels of stress can have a huge impact on overall health by promoting chronic diseases, and one of them is thyroid disease, through these mechanisms that drive high cortisol and decrease thyroid hormone production. The 4th way that blood sugar can impact thyroid function is through a condition known as polycystic ovarian syndrome. It's also known as PCOS. It's also very commonly associated and confused with thyroid disease because it has very similar type symptoms. Women with PCOS suffer with weight gain, hair loss, fatigue after meals, hormone dysregulation, and sugar cravings. On labs, PCOS will display altered lipid metabolism, insulin resistance, which is blood sugar issues, and increased levels of testosterone. This combination can trigger autoimmune Hashimoto's hypothyroidism directly or indirectly by driving up insulin production and triggering an immune response, as we've discussed in relation to the high blood sugar. Either way, PCOS is important to identify because it can not only mimic low thyroid, it can also cause it. So those are the ways that blood sugar can impact thyroid metabolism. There are also 4 ways that hypothyroidism can impact blood sugar, creating a really vicious cycle. Low thyroid hormone can decrease the amount of sugar that is able to be absorbed through your gut. This can lead to a spike in cortisol to compensate, leading to the cortisol issues we previously mentioned. Once in the bloodstream, though, the ability of the sugar to get into the cells where it's needed for energy production will also decrease. Hypothyroidism will also lower your cell's ability to respond to insulin, which is necessary to get that sugar into your cells. These 2 mechanisms both lead to more sugar in the blood, which in itself can cause increased issues with low thyroid. Finally, with low thyroid, you cannot break down insulin easily, which can lead to inflammation, which, as we mentioned earlier, can cause low thyroid. As you can see, it is a really vicious cycle. Low thyroid problems leading to blood sugar problems leading to low thyroid. We need to jump into this cycle and stop the madness. So, as you can see, thyroid issues are not as simple as just taking some thyroid medication. There are other major physiological mechanisms that can interfere with thyroid metabolism and vice versa. It's critically important to define all of the contributing factors and to address them appropriately. If you have thyroid symptoms and you want to know if you have blood sugar problems and how I can help you, contact my office today at the phone number below to schedule a consultation to see if you qualify for care. Thank you and have a great day.